Hello, my name is Tammy Stoneman. I am a fourth year student at Agolma University in the BSW program, doing placement for a safer space, FASS. Now, before we begin, I want to acknowledge the Robinson Huron Treaty, and the land on which we are gathered is the traditional territory of Anishinaabe nations. This is important as we are all treaty people. So the topic today is safety and self-care in crisis situations. Okay, so let's look at the agenda. Crisis planning and utilization of social workers. We're going to look at that. We're going to look at individual crisis planning. We're going to watch a short video. We're going to look at social work after a crisis. What are the risks involved with for social workers? What do social workers need to do to combat those risks? What does self-care look like? I added some questions to help people determine if they are at risk. And I'm going to add my thoughts, and then the end slide will be thank you, the end. Okay, crisis planning for local communities and regions include multiple organizations and the utilization of social workers. The local communities and regions are legally responsible to have crisis management plans and strategies. The plans include sending first responders, police, firefighters, paramedics, doctors, nurses, social workers into crisis situations. Also, organizations like Red Cross and the United Way and other volunteer organizations normally aid in crisis situations. Social workers who volunteer will use Maslow's hierarchy to meet the immediate needs of survivors in crisis. So while they're going through crisis, social workers will make sure their psychosociological needs like food, water, warmth are met. These are what Maslow calls basic needs. Safety is also a basic need, and safety includes shelter and security. And after or during a crisis, some people might need assistance in finding loved ones, later with their self-esteem, love, belonging, and then self-fulfillment, self-actualization. Now, I'm not going to touch on the psychological needs or the self-fulfillment needs in this presentation. I just wanted to put them there so you're aware. The importance of crisis planning. Being prepared will improve your chances to successfully survive natural disasters. So individually, we can ensure we have an emergency kit, water, non-perishable food, flashlights, batteries, candles. If able, a generator, store extra fuel, medicine, and have a first aid kit. Know where you can access supports, contact with family or friends, and include them in your crisis plan. Seek out assistance if it's safe to do so. Go to areas designated in your community, designated safe zones. Wait for help if you cannot safely leave your home. Put sign or bed sheets outside to flag down emergency responders. That's what we can do individually. Now, this short video starts off a little, almost kind of like a dictionary, but it has a lot of great information, and I picked it because it does have a great take on crisis intervention, and it's from New Delhi.
Hi friends, I am Karnik.
Hi friends, I am Chaiko.
Friends, welcome to Globally.
Friends, like this video.
Share this video.
Subscribe this channel.
Please comment for any queries and clarifications.
Thanks friends. Hello, Karnik. I have some questions.
Okay, please ask.
What is crisis intervention?
Very good. It's a nice question and very important for all humans. Crisis intervention is an immediate and short-term psychological care aimed at assisting individuals in a crisis situation in order to restore equilibrium to their biopsychosocial functioning and to minimize the potential of long-term psychological trauma. Crisis can be defined as one's perception or experiencing of an event or situation as an intolerable difficulty that exceeds the person's current resources and coping mechanisms. Crisis situations could be in the form of natural disasters, severe physical injury, sudden death of a loved one, and specific emotional crises as a result of drastic transitions such as divorce, children leaving home, pregnancy, or family and school violence. The priority of crisis intervention and counseling is to increase stabilization. Crisis interventions occur at the spur of the moment and in a variety of settings, as trauma can arise instantaneously. Crises are temporary, usually with short span, no longer than a month, although the effects may become long-lasting.
You explained crisis.
Crises can occur on a personal or societal level. Personal trauma is defined as an individual's experience of a situation or event in which he/she perceives to have exhausted his or her coping skill, self-esteem, social support, and power. These can be situations where a person is making suicidal threats, experiencing threat, witnessing homicide or suicide, or experiencing personal loss. While a person is experiencing a crisis on the individual level, it is important for counselors to primarily assess safety. Counselors are encouraged to ask questions pertaining to social supports and networks, as well as give referrals for long-term care. Societal or mass trauma can occur in a number of settings and typically affects a large group or society, such as school shootouts, terrorist attacks, and natural disasters. A counselor's primary concern when called to these types of crises is to assess people's awareness of resources. Individuals experiencing trauma in a large scale need to be aware of shelters that offer food and water and places that meet their basic necessities for survival.
You explained signs of crisis.
Counselors are encouraged to be aware of the typical responses of those who have experienced the crisis or are currently struggling with the trauma. On the cognitive level, they may blame themselves or others for the trauma. Often, the person appears disoriented, becomes hypersensitive or confused, has poor concentration, uncertain, and poor troubleshooting capabilities. Physical responses to trauma include increased heart rate, tremors, dizziness, weakness, chills, headaches, vomiting, shock, fainting, sweating, and fatigue. Among the common emotional responses of people who experience crisis in their lives include apathy, depression, irritability, anxiety, panic, helplessness, hopelessness, anger, fear, guilt, and denial. When assessing behavior, some typical responses to crisis are difficulty eating and or sleeping, conflicts with others, withdrawal and lack of interest in social activities.
Thank
Okay, so that video, I really liked it because it explained what a crisis can be, because there's many different types of crisis. And if I would have included all of these different types of crisis, this video would be like maybe an hour long. So I'm sticking just to the basics. Okay, social work after immediate crisis. After an immediate crisis, social workers will have more work to do with people. Like you heard in the video, there'll be, long-term referrals given to some people. As some people who survive a crisis will have varying degrees of trauma, and they require longer-term counseling. It is imperative social workers recognize they need to be cognizant of their own personal well-being and safety. Social workers are people living through the same crisis and are at risk. Today, we are all living through a global crisis. COVID-19 and the variants continue to force people out of jobs and into isolation. So social workers are dealing with the high rate of community job loss and the well-being of people in the community. Social workers can become burnt out because of this, can experience compassion fatigue, countertransference, vicarious trauma during a crisis or after. Thus, we need to practice self-care. What are the risks? I just want to point out the definitions. So being burnt out is a professional weariness and extreme exhaustion, both physically and mentally. Burnout is due to things like being overworked and not taking time to do self-care. Compassion fatigue strips away the empathy social workers need to work with clients. Without empathy, the efficacy, that's a hard word, efficacy of social work is or becomes deficient. Social workers cannot help others if they are not taking care of themselves. Countertransference happens when a social worker is triggered by listening to stories that brings them back to their own unresolved issues. Social workers need to do self-care to resolve personal issues that can interfere in aiding others. Vicarious trauma affects the social worker's worldview and sense of self. Exposure to crisis or trauma of others can blur the boundary lines as social workers' beliefs and thinking begin to shift in response to a client's trauma. So these are very important to know, and we need to know what to do if we are having any of these signs. So what to do? Social workers should engage in restorative activities, seek out support if needed, resolve to make self-care a priority. That actually should be number one. Know your own limits. Recognize your happiness equals effectiveness. Manage your time. And this could be difficult in times of crisis or trauma. Make a self-care plan. That actually should be number two. Take the training on the early signs of burnout seriously. What does self-care look like? Well, it can be leisure activities you enjoy, like fishing, watching a sunset or sunrise, baking, crafts, reading romance novels, or other books of interest, and going out with friends. Have fun. Activities like swimming, camping, yoga, running, going to the gym with friends, or biking, anything that does not involve your practice. Travel or go on a vacation. Find support, supervisors, friends, peers, professionals to talk through your worries. Continuing education and monitor your own mental health. Take care of your mental health. Eat properly and get enough rest. Engage in spiritual activities. If you're like me, go to church. Practice mindfulness. Get back to nature or practice meditation. Okay, so questions to ask yourself. These are some of the questions I ask myself. Am I experiencing fatigue? Is it because I'm not sleeping well? Am I anxious or agitated? How am I coping at home? How are your closest relationships? Are you ignoring your friends? Isolating yourself? Do you feel depressed? Has anything changed in your life? Are you no longer feeling good about the activities that usually make you happy? Are you happy at home or in the workplace? Be honest with yourself. Do you feel overwhelmed and do not want to go into work? These are all signs or questions that can help you recognize if you're becoming burnt out. Additionally, asking questions of yourself can help determine if you need professional help. Social work is a very mentally demanding profession, and your mental wellness is essential in helping others. Okay, so many may say self-care is selfish. This is not true. Self-care allows a social worker a break from all the stress they will feel as a social worker. Knowing your own limits will aid in job satisfaction, your overall happiness. Paying attention to your own mental well-being will let you know when you have reached your limit and can prevent the stress that can harm you. Ensure you make a self-care plan as it will promote wellness, increase your productivity, job satisfaction, and it aids in professional growth as well as nurtures relationships. I like this little picture because it kind of defines what self-care is. Self-care is not selfish or self-indulgent. We cannot nurture others from a dry well. We need to take care of our own needs first. Then we can give from our surplus, our abundance. And that quote is from Jennifer Loudon. So at this time, I want to thank you for listening to the presentation. Again, my name is Tammy Stoneman. I'm a fourth year student at Algoma University, working with For a Safer Space, FASS, finish my placement hours in the BSW program.